I think what people don't really understand, normal people who don't, have experiences with these type of things, is that me personally, I had no idea what was going on. It's not like I became angry at something, or that something had really happened to me that was emotionally devastating. It was just like I lost touch with reality. I had been a normal kid, happy-go-lucky. My friends would poke fun at me because I was always smiling and always making jokes, and I was the most upbeat. And then in a matter of days, like my mom said, everything became sort of, it felt like the reality that I had known was distant. And I couldn't communicate. I was at that point hearing voices.
You were?
Yes. Mainly in music. I don't know how to explain it, but the song lyrics would change, and they would say hateful things, racist things, homophobic things. They would tell me to harm people. They would talk about harming people. And I really didn't know how to vocalize it, because I think any rational person would be like, "You're making this up. This isn't true, Andrew." It's sort of like the boy who cried wolf. So I figured I wouldn't cry because no one was going to come for me.
So did anybody ever come up with a diagnosis here?
At that point, it was determined that Andrew had psychosis, otherwise unspecified. And that was in June of 2008. And he was in the hospital for about 5 days. Then he came home, and he was better after receiving some medication, and he was seen by a psychiatrist for several months. And then he went off his medication after about 6 months, and about 3 months later, without any other form of treatment, no more visits to the psychiatrist, no more talk therapy, he had his second psychotic break.
So eventually, Andrew, did they tell you what you had, what you were suffering from?
Yeah, my family and I met with a psychiatrist at UCSF, and after one meeting, probably 30-minute meeting, he decided that I had schizophrenia. And I didn't feel very good about this diagnosis, because undisclosed psychosis it sounded 10 times better than schizophrenia. When I thought of schizophrenia, I thought of teenagers, beating up people and, breaking laws and acting like hooligans in a way, out of control. And that certainly wasn't me. I was never physically aggressive, sometimes frustrated, but I never hurt anyone in my experiences with psychosis.
Or otherwise.
Yeah.
But you said that when you were hearing voices, especially in this song, they were kind of urging you on to some sort of physical something.
But my parents brought me up well, and I knew that this is something that's totally unacceptable in society, to hurt anyone. And so I resisted these messages that I thought were being sent to me. And I'm glad that I was able to persist and to avoid any physical altercation.
So I'm going to put these earphones in, and they're going to try to do a series of tests. Okay, so I'm now hearing sort of whispers and voices in my head, and the first test is on some number puzzles.
Listen, you suck and they know it. Can't you get this right?
Okay, so I did this test for 3 minutes and I did not get a single one. It's very hard to, concentrate if it's like music or something constant, it's easy, but people talking to you is very difficult. So now I'm going to be asked a series of questions by our producer, Susan, and these are basically a series of questions that a person would be asked if they were being admitted to a hospital.
Can you tell me what day it is?
Yeah, it's Sunday, June, I don't know, what's the date, 7th?
So I'm going to say 5 numbers, and I want you to repeat them back to me after I'm done.
Okay.
5, 23, 67, 2, 76.
5, 23, 67, something 76.
I'm going to say 5 words. You don't have to repeat them, but just listen to them. Cat, book, cigar, damage, and rain.
Make you okay.
Can you name the last 4 presidents of the United States?
Okay for you to be
Barack
here.
Obama, George Bush,
Here. Here. Right here.
Bill Clinton, and George Bush.
Hear it? Hear
So
it
those
now?
5 words I said before, can you remember any of
Here
them?
and here. Hear it.
No. It's hard because sometimes the voices are like whispering, and sometimes they're aggressive, and sometimes they're kind of comforting.
Hear the tree.
But again, with people kind of talking to you all the time, it's
okay.
it's hard.
Don't worry. Now or later.
So I'm going
don't
to try to
worry.
make a boat out
You
of
all right?
origami following these instructions.
Hey, it'll be okay. Near. Near. Get near.
Shut up!
I want to talk back to the voices now, but it's really distracting. It's,
Do not do it. Do not touch that stuff. Eyes down. You suck! What are you looking at? This is easy. You want to touch that?
I can't do this.
Hand down. Keep your eyes down. Just do it, Stuart. Just do it. Filthy mind. Leave it alone.
It's also frustrating because they're telling me I can't do it, and so I didn't do a very good job with the boat. But it's really hard to focus when kind of people are whispering to you and talking to you.
Just come clear. Come near to me. Come near for help.
Hey, do you have yesterday's paper? Yesterday's New York Times? No? Okay, I'll just get today's. It's incredibly distracting on the street to have somebody talking in your head, and it makes you feel completely isolated from everyone else around you, and you don't want to engage in conversation with other people. You kind of find yourself wanting to engage in conversation with the voice in your head because they're constantly being really negative and talking to you, and everything they're saying relates to things that you're actually doing. They're criticizing things you're doing. It's like it's like you have a chorus watching you and commenting on what you're doing, and you can't help it. I mean, I literally find myself wanting to kind of respond to them, kind of tell them to be quiet, and it's incredibly unpleasant. This is a very, very unpleasant experiment. It's really, it's eye-opening because it kind of really shows you what other people must be going through who deal with this on a regular basis. But also, like, I cannot wait to take these headphones off because it's really depressing. It's very negative. It makes you feel very, very negative. Yeah, it's very creepy. I want it to stop.
Eyes down. Back up. Stand up now. I'll count you off. I'll count 20, 30, 40. Stand up now. Walk away.
You're okay.
Walk now.
Pacify. Pacify. On to pacify. All the way to make it home.
Bipolar disorder is a mental illness that around 6 million Americans suffer from. Although I'll tell you, it's really hard to know the numbers because sometimes people don't seek help. Bipolar depression, manic depression, these are terms that are all meaning the same thing. The manic part of it, think of that as the highest of highs in your life. You feel great, you may be more reckless though. The depressed part of it is sort of the lowest of the lows. I want to try and simplify this for you because I find this really fascinating. Here are the frontal lobes of the brain, and deep in here is an area of the brain called the amygdala. Think of the frontal lobes of the brain as your judgment area of the brain, but also your brakes. The area of the brain that tells you to slow down, to stop, think a little bit before you do something. And think of the amygdala as the emotional center in the brain. So someone who is manic typically has no brakes, frontal lobes are not really active, and the amygdala is red hot, meaning it's super active. Things that you think, you immediately do. It may lead to wild bursts of creativity with unlimited energy. That's oftentimes what the manic phase is. Depression, think about it as exactly the opposite. The frontal lobes are now turned all the way up. That means everything is just stopped. Nothing's getting out. The amygdala turned down. It means you have just no emotion. So you're apathetic, you don't want to get out of the house, you simply don't want to do anything. That's what's happening in the brain of someone who has manic depression. The episodes can last hours, they can last days, they can last weeks. People can go through cycles over a time. So within a year, you could have 4 cycles from mania to depression and so forth. Typically, people really start to develop symptoms in their late teens and early 20s. About half of people are diagnosed before the age of 25. Many people can get good treatment for bipolar depression, but I think it's fair to say that it's not easy. First of all, it can be challenging to get the diagnosis. Second of all, it can be challenging to trial medications, see if they're working. But the key is ultimately finding a medication that's more of a mood stabilizer. You don't want to give someone an antidepressant who could possibly go into a manic phase. That could just worsen the mania. It's more about giving mood stabilizations to cut down on the intensity of the mania and the depression.
Well, it touches the lives of nearly 18 million people in the U.S., yet many people with depression either don't ask for treatment or they don't have access to it.
And unfortunately, here in Louisiana, the number of people with depression is on the rise. Medical reporter Meg Ferris explains how you can get help.
The numbers about the rise in depression in Louisiana at first glance seem, well, depressing. CDC numbers show Louisiana had the second biggest rate jump in depression in the nation over 5 years. And the state is near the bottom, number 40, when it comes to you being able to see mental health experts. Important because states with good mental health care access have significant decreases in depression. So we asked LSU Health developmental psychologist Dr. Anthony Spire for advice.
If you're really feeling out of control with the depression, that you just can't do the things you want to do, then you can't ignore it.
Dr. Spire says treatment helps the illness of depression. And he says the jump in patients may be because more people can now be diagnosed. First, more people have insurance, and there is new access to mental health care.
In fact, the door is open and people are walking through it.
Here's why. After the major hurricanes and BP oil spill, behavioral treatment doctors and telemedicine were added at primary care clinics statewide.
When you go in annually, just say, I'm not feeling the way I would like to feel.
And that is for any mental health problems, including addiction. Meg Ferris, Eyewitness News, Medical Watch.
And you can go to WWLTV.com for a list of treatment options for mental health, addiction, and depression, even if you don't have health insurance.
I found these pictures of Julie Anders and I, and we were singing the reprise of 16 going on 17 here.
Millions remember Charmian Carr as the 16 going on 17 Liesl in the 1965 classic The Sound of Music.
I was very happy then. It was like a fairy tale.
But in more recent years, Charmian has suffered from bouts of extreme depression.
It affects every part of your life, but you continue. You just continue.
Clinical depression is a brain condition in which a person is deprived of their ability to experience joy. Many times people say that it's as if they've been enveloped in a deep, dense layer of clouds.
Charmian got some relief from medications, but over the years, she says, the benefits became less and less while the side effects got worse.
People thought I had Parkinson's disease because I shaked so much from all the medicines.
Charmian is undergoing the latest treatment for depression recently approved by the FDA and available at UCLA. An outpatient office procedure using a powerful external magnet.
The magnet produces a very strong magnetic field. It's about 1.5 Tesla, which is about the same strength that you see inside one of those MRI imaging machines.
Charmian listens to the soothing sounds of ocean waves while the strong magnetic field is delivered in a series of pulses directly into the part of the brain known to affect our mood.
It's like sometimes a little woodpecker, sometimes a big woodpecker. And then I just close my eyes and picture being on a surfboard and watching the dolphins.
Our best understanding is that when we stimulate a certain part of the brain called the left dorsolateral prefrontal cortex, it's kind of the area on the left behind the forehead, that area is very important in regulating mood. And when we boost its activity over and over again with this kind of stimulation, we're able to get it sort of to lift its activity and stay in that higher state.
Researchers say people who suffer from depression show less activity in specific areas of the brain. These images show an increase in activity in those same areas following TMS treatment.
These individuals had excitation of parts of their brain not only adjacent to where the TMS coil was placed, but at other locations throughout the brain that are also involved in regulating mood and emotion.
Patients undergo TMS for about 45 minutes daily from 4 to 6 weeks. No anesthesia or sedation is required, and patients can go back to their normal activities the same day.
Fine.
After a few weeks of treatment, Charmian says she is experiencing some relief.
The big result is I have been free of medication for almost 6 weeks now, for the first time in over 20 years.
There's nothing quite as satisfying as seeing a person who has struggled with depression for months or maybe even years suddenly have the sensation that the fog is parting, the light has come on, they have a glimmer of hope.
I have gone back to dance class as of last night, and to have another alternative has been wonderful for not only me, but for my family and my grandchildren.
You're worried. Your child has been sad or irritable for days and doesn't seem interested in activities they usually find fun. They're not eating the same way. They don't spend time with friends. School is a struggle, and despite their low energy, they can get easily riled up and angry. 1 in 10 adolescents has depression. NIMH conducts research studies to understand the causes of depression, the teen brain, and evaluate new treatments. Studies enroll participants ages 11 through 17 for research assessments, brain scans, talk therapy, or other standard treatments. Find out if your teen is eligible to join a research study today. Visit nimh.nih.gov/teen depression study and get started.
Welcome back. Well, earlier this week, NBA star Kevin Love revealed his struggle with panic attacks. And as we were talking about it around the table, Carson, then you shared your own story and experience with anxiety.
Unexpectedly, too. I just started talking about, inspired by that Kevin Love story. It's something that I can't change about myself. In fact, it's okay. I've learned to embrace it. And hopefully, by just being honest and maybe opening up, it'll inspire others to do the same. Looking back on my life, I was a worrywart kid. I was always worrying. My father died when I was 5. I had an ulcer when I was in high school. I've been nervous my whole life. My very first panic attack happened, and by the way, I didn't know what it was at the time, happened when I was a host at MTV.
Welcome to the show, Total Request Live.
The success of my career, I mean, I moved to New York and my life changed overnight. I had a hard time breathing. I was terrified for no apparent reason. At times, I feel like there's a saber-toothed tiger right here, and it is going to kill me, attack me, and bite my head off. I'm scared as if that's really happening. you feel like you're dying. In fact, I went to the hospital, and the first thing you put it on, I got leads on my chest. I'm like, my heart's going to stop, or I'm gonna have a heart attack. And of course, what happens is you're perfectly fine. To this day, even when I'm on television, if you ever watch The Voice live on NBC, watch on a Monday or Tuesday night, I'm never still. It's the same thing on Today's Show in the morning. Some days I'm just a little anxious. And you'll see me. I mean, you could be able to tell. You'll see me, I'm fidgeting. People think, you know, they hear, oh, he's anxiety, you know, he's on high pressure life, you know, they're on television. It has nothing to do with that. I've had heightened anxiety and mild panic attacks at the playground with my own children and wife there, and the feeling was so gripping, so terrifying, that I literally had to leave and excuse myself. I've done relaxing things, like I rode my motorcycle across the country to find some relaxing time, and had, you know, panic-stricken moments in that. This is the way I was born. This is the way I'm hardwired. This is kind of the downside of the way God made me, and there's a tremendous upside as well. I'm very sensitive. I love music, and music moves me in a very visceral way, physically. So I get the chills when I hear, you know, certain music, definitely like soul music. When I'm with my family and it's a euphoric moment, those things resonate to me very, very deeply. And that's a beautiful thing, because I feel so much love and empathy and compassion. And that's just the flip side to a lot of the anxiety. I don't walk around every day, you know, a nervous wreck. I don't want people to watch this and think like, are you okay? Are you freaking out right now? It's like, no, I'm good. You know, they'll watch this piece and go, well, how do you fix himself? How do you fix it? Because we live in that world where it's like, what do you take? I'll take that too. It's not that simple. What helped me was talking to a friend once who said, everything you're experiencing, I have too. You have anxiety. You should go talk to somebody about it. And I'm like, it's a thing? Anxiety's a thing? I thought it was like stress, like not really a thing. I opted for a cognitive therapist, somebody who really teaches you kind of about anxiety, the model of it, and offers you tools on how to kind of, you know, work through it. So the muscle retention, relaxation really helps me. I'll do one now. This will actually help me because I'm nervous doing this interview. So I'm gonna clench my fists and my arms and my biceps as hard as I can, like I'm lifting a weight. Wow, that felt great, like an ocean of relaxation. I mean, I really wear the way I am like a badge of honor. This is who I am, and I'm proud of it. I may be a little anxious, but I know I'm gonna be okay.
We're so proud of you.
So funny. You can hear my father talking in that, because as it pertains to men's health and anxiety, that was my dad growing up, was, you know, there's no such thing as stress or anxiety. It's not the flu or breaking a bone. Rub some dirt on it. As boys, we grow up like that.
Yeah.
And then, you know, anxiety, and the doctor can talk about it, you literally feel like a little boy when you're really uncomfortable having anxiety and you want your mommy, which is the antithesis of how you grew up.
Yeah.
So I was inspired by Kevin Love's piece to say, hey, listen, if you're out there and you're dealing with any of this stuff, go find somebody and, you know, talk to somebody.
And let's introduce our guest. This is Tom Kirstein. He's a licensed psychotherapist. He's an author of the book Disconnected. And I mean, I think Carson has done a really brave thing, which he does every day, actually, by just coming on and in spite of his fears and in spite of that anxiety, coming on and, you know, just doing this job so well. But I mean, it's also important because I think a lot of men do have that stigma.
It really is. I mean, when you look at the statistics, like more women seek treatment than men, okay? And this is why you see the statistic when you hear that more women have anxiety than men. That's not really true. It's just that more women go and seek the treatment. And sort of like what you're talking about, like the guy thing as well. You know, we got to push things under the rug. I'm a man. I'm having anxiety right now as we're talking. You know, literally. And literally, my heart rate is up right now because I'm, you know, here. This is important. But it's something which is great that you and people like Kevin Love can come out and say that this is, you know, relatively normal to some extent.
How do you know if it's stress? Or if it's something more, if it's something you should go speak to someone about?
Well, if it's really debilitating to you, to the point where, you know, you can't sleep at night, okay, you're having a hard time functioning at work and so forth, and it's just crippling you, then that's the time to go and seek some help and have somebody to talk to. And the men, you know, you get more women in my profession that come to your office, but the men, usually it's the, you know, the wife kicking them in, saying, listen, you gotta go see somebody. And then when they do, that becomes the highlight of their week. It's now an outlet for them to unwind, to reframe their thinking, to understand their inner being, and learn from them.
Well, and I think it was interesting what you said, because a lot of people go, okay, wait a minute, does that mean that I'm supposed to be on some drug or something, and I don't want to sign up for drugs for the rest of my life? But you've actually felt with this cognitive behavioral therapy, it really makes a difference.
Well, it's important for me to understand the model. I wanted to understand. It's just like flying. If you're scared to fly, go learn about avionics and flying and lift and aerodynamics and learn about it. You're still going to be nervous in the air, but at least you'll have a clear understanding as to how it all works.
Yeah.
So I have an understanding about how I work. Also, framework is everything, no matter, listen, people are so afraid about what other people think of you.
Yeah.
You know, and I wish people could break down that wall too, because I guarantee you, everybody's got something. Everybody's got something. It's how you deal with it.
And interesting that you're talking about this others. I give a lot of lectures, and I talk about self-esteem. And what's the important word there? Self. Yet many people in our society nowadays are trying to extract attention from the outside world to fill themselves up, and it doesn't work that way. We've got to go inside ourselves and unfold what lies deep within ourselves.
Carson, that was terrific, by the way.
Happy to do it.
Such a good
I wish I could open up a
conversation.
phone line. I would take all the calls. Happy to help.
That's what the Orange Room is for. And I hope people do, you know,
We'll have a
share. And a lot of
telephone.
people have shared with Carson, and I think it makes a big, big difference. We want to put more information on our website. Look at this. Somebody tweeted, I never knew there was a name for how I feel. Thanks for sharing, Carson, and help me not feel alone in my
I'm with
suffering.
you. I'm right there with you, Marcy.
We all are.
All right.
Hello, Today fans. Thanks for checking out our YouTube channel. Subscribe by clicking that button down there and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives.
Do you seem to worry about everything all the time? Work, family, finances, your health? Or do you worry a lot about people judging you? Do you feel anxious in social situations? We are conducting research studies to better understand these kinds of anxieties that affect over 21 million Americans. We hope that learning more of how brains and bodies work when you're anxious will eventually lead to better treatments. If you're between the ages of 18 to 50, you may be eligible for outpatient studies that may involve research assessments and computer tasks, among other procedures. There is no cost to participate. Compensation is provided. Join a study.
As the name implies, generalized anxiety disorder refers to anxiety that is pervasive for an individual and involves the individual worrying about several different arenas of their life at the same time. It's also not limited to discrete episodes, but is, as again the name implies, generalized in that the anxiety is experienced for most of the day, if not all day, every day by these individuals. And the other thing that's important to keep in mind is that the worry can't just be everyday worry, but it's a level of worry and anxiety that interferes with an individual's ability to function. They're so concerned, they're so anxious that it actually interferes with their ability to get things done, and they'll avoid certain activities because of concern over the anxiety or the anxiety itself. In terms of treating generalized anxiety disorder, the best treatment is a combination of using medications and psychotherapy. The medications should be medications that can help prevent anxiety because these individuals have their anxiety all the time, and the psychotherapy component can help the individuals understand what the triggers are and why they're having the anxiety to begin with, and as they gain a mastery of understanding their anxiety, they will hopefully be able to control it in a way that doesn't interfere with their lives. However, it's important to understand that these people are not choosing to be anxious, so they should certainly be evaluated and strongly consider medication treatment because they're not going to simply be able to control their anxiety. If they could, it wouldn't be a disorder. So generalized anxiety disorder is, as the name implies, a general state of anxiety, and it's very amenable to treatment. If you or someone you know thinks they may have generalized anxiety disorder, it's definitely a good idea to get an evaluation with a psychiatrist to find out what might be done to help.
My anxiety does not define who I am. It's a piece of who I am, but it's not me. It's not Michaela. It's just a small fraction of me.
Michaela is my middle child, and she is just a beautiful, smart soul. She is artistic, she loves to laugh, she loves her family.
Anxiety has been a part of my life for as long as I can remember. I was officially diagnosed in 3rd grade with social anxiety disorder. Living with anxiety is like living with this overwhelming fear, these obsessive, anxious thoughts that are never stop going through your head. It keeps you from doing the things that you love to do.
It was interesting going to school, meeting other mothers. They would see Michaela and they would be like, just make her do it. You can force her to go to school. So she cries a little bit. She'll be fine. But I knew that she was not playing me. She was truly struggling. It was very hard for her. And you could see it in her eyes. And I could see what she wanted to do but was not able to do it.
In a way, putting a name to it validated it. It's like, this is something real that I'm struggling with. And at the same time, I think it added more stigma to it. You don't even know what the word anxiety means. I don't know, why do I feel like this all the time, and why don't other people feel like this?
When she was diagnosed, it was a sort of relief of, okay, this is what we're dealing with. But also my heart hurt for her. It hurt because, you know, I wanted her to be able to enjoy life, to enjoy friends, you know, for the world to see who she was.
You know, our body is like a vehicle, and our brain is the engine in the vehicle. And some engines are different than other engines. And sometimes with kids with anxiety, it's like their brain is a race car. It's very touchy, and they need to learn how to drive it. They need to learn the skill set of being able to put their hands on the steering wheel, to be able to take their foot on and off the gas, and what those skills look like. And instead of interpreting that something's wrong with them, they can interpret it that they need to learn how to drive a specialized engine.
In middle school, I definitely felt like, oh, there's something wrong with me. Once I got into high school, I was like, there's nothing wrong with me. I just struggle with something that other people don't struggle with, and I just have a brain difference. My brain just works differently than other people's, and what's so bad about that? I'm not ashamed of it. I would not trade my anxiety for anything. As I said, it doesn't define me, but it is part of me, and it's made me a much more empathetic person, and it's made me a more creative person, and it helps me understand a lot of what other people are going through.
Now, to look back, I am so proud of my daughter. I have never been ashamed of her. And she has come so far. And it really does you good to see where she's been and where she is now.
I don't know what I would have done without my family. They've never made me feel like there's something wrong with me.
What I wish we understood is giving children the power to be able to see their specialness and their uniqueness, at the same time as set the bar at something that they can handle and keep working at skills. Over time, we think these are the kids that produce creative, artistic expressions. These are our novelists, these are our artists.
When you first have those babies, you have so many ideas in your head, how it's going to go, how you're going to be as a parent. But you learn with each child, you got to learn to love your child for who they are, because every person is special. And that's what makes this world so great.
I'm Jeannie C., and I'm here to speak with you about mental illnesses that are often confused with schizophrenia. There are many different illnesses that can cause what we call psychotic symptoms. So those include delusions, feeling paranoid that people are out to hurt you, or feeling grandiose, feeling that you are maybe more important than you are, that there's a mission to accomplish, or so forth. And hallucinations, where you hear or see things that people don't hear or see. And so those things also occur in bipolar disorder and in major depression as well. And maybe it's a bit artificial how we have divvied these up in psychiatry in our the diagnostic and statistical manual. But basically, if you have primarily depressive moods, even if you hear voices as part of them, or even if you feel paranoid as part of them, if it's a depression that comes and then goes, then that's actually depression, not schizophrenia. If you have a depressed and a manic picture where sometimes you have increased energy and don't sleep and are a bit reckless with your activity and have voices and paranoia, then you may have bipolar disorder instead. The thing that makes schizophrenia or schizoaffective disorder different than bipolar disorder or depression is actually that you have these delusions or hallucinations in the absence of any mood symptoms. So those things are often confused. Sometimes people will have one psychotic episode, comes out of the blue, they hear voices, they feel paranoid, and then it goes away. That's not schizophrenia. Just because you've had one brief psychotic episode does not mean that you're going to have schizophrenia and that this is going to be with you for the rest of your life. In fact, what we also require to make the diagnosis is a gradual decline in functioning that occurs over a longer period of time. In addition, there's been a lot of confusion because the name schizophrenia in Greek means split mind, that split personalities is involved in schizophrenia. In fact, that's totally not true. What we think about when we talk about split personalities, having a few different identities, is actually called dissociative identity disorder, and is actually a fairly controversial diagnosis. Sometimes people confuse autism and schizophrenia as well. Autism is a developmental disorder where people have more difficulty with social skills and social awareness, and that can look a lot like schizophrenia, but and some people with autism also have schizophrenia, but people with autism do not generally have all of the paranoia and hallucinations that someone with schizophrenia has. When we are trying to determine if somebody has schizophrenia, we also need to rule out whether the psychotic symptoms or the decline that we're seeing are due to a mental illness only, or if they're actually due to a substance that the person is using, so things like amphetamines or LSD, phencyclidine, which is angel dust, or PCP, or sometimes even marijuana can mimic the symptoms of schizophrenia, so we have to rule that out. And then many medical conditions, especially ones that affect the brain, like lupus or Parkinson's disease or dementia, can look like schizophrenia as well. So we have to rule that out before we can make the diagnosis.
Settle down. Don't get up. You're good. Don't do anything. Stop what you're doing. Don't do anything. You're good. Just stay in your bed all day. Head up. Don't do anything. Do nothing. You can do better. You are good. Hi, I'm Michelle Hammer, and I have schizophrenia. Schizophrenia is a mental illness that changes the way you think, feel, and act. It's broken down into 3 separate categories: positive, negative, and cognitive. Positive symptoms don't mean they're a good thing. It's an add-on to your normal behavior. Things like hallucinations, delusions, and voices.
I had so many ghosts and shadows inside of my mind.
A demon was perching on the end of my bed.
Negative symptoms take away from your behavior.
I showed no emotion and I was just totally out of it.
Cognitive symptoms make it hard to pay attention and hard to focus.
Their brain is just racing. They can't stop.
The pathology of these illnesses has only become recently understood.
Schizophrenia is different for everyone. My symptoms aren't like everybody else's. My first symptoms of schizophrenia was pretty much just zoning out, thinking I was in a different place. Then it turned into kind of voices in my head that just plagued me over and over again. I thought my mother was trying to hurt me. I didn't know what to do about anything because I thought everyone had it out for me, so I didn't know who to go to for help. Sometimes I kind of hear a voice more coming from the right side of my head saying like, everyone hates you, stop what you're doing, don't do anything, nothing. Well, it's kind of like the other side of me is kind of arguing back with the voice. Don't worry about anything, chill, just chill, breathe, chill, just chill, you can get through it. And it's kind of just like the thing is, who's gonna win, who's gonna win, who's gonna win? When I take my medicine, the good sign wins. I mean, living in the city and having schizophrenia is interesting just because, you know, I do hear voices as I'm walking down the street. So in my head, I'm thinking of the person talking to me, but then I start talking back to the person. And then maybe I'll snap out of it, look around, and like 5 people are staring at me. But mostly I kind of just get plagued by thoughts that are just so repetitive in my head and they just go around over and over and over again, when really I just want it to be nice and quiet and silent. All through high school, I had this like really crazy paranoid delusion that my mother was trying to kill me. Every time she went to try to get me to a therapist or anything, because she knew something wasn't right, I always thought she was trying to ruin my life. So when I went to college, I thought I was free of her. And everything was great, and then all of a sudden, my best friend, my roommate, I started thinking the exact same things about her. So realizing that I had the problem was like the start of the entire thing. And that was the hardest thing to do, I think, realizing there was a problem. At 18, I was told I was bipolar, but I kind of knew that diagnosis was incorrect. So at 22, I spoke to a different doctor, and I was more honest with him, and he diagnosed me with schizophrenia, and that was like the best thing that ever happened to me because he got me on the right medication, and I feel as good as I can possibly feel right now.
I finally told a therapist about what was going on with me. I had all these problems, and I finally had a name for them.
Over time, we've realized that mental illness is nothing more than physical illness. Talk to as many people as you can. Don't be ashamed. Don't be judgmental.
I see a psychiatrist every other week, and we just kind of talk about things that are going on. Mostly I just share really silly stories with him, and we just laugh a lot, when really he's measuring just my mood. And that's what I know that he's doing. For my medication, I take 7 daily medications, 6 in the morning and 1 at night. The ones in the morning just get me ready for the day, get me focused, make it so I can get out of bed without having a horrible day. And the 1 at night just keeps me kind of level, knocks me out, and lets me have a good sleep without completely panicking in the middle of the night.
It can be very lonely having schizophrenia. The paranoia, the fear, the voices, everything that goes along with it.
The compliance with medications is going to ultimately lead to a recovery, and your son or daughter can not only be okay, but they can be great again.
It took a process of almost 10 years to get me on the right medication, so I'm glad that I finally am. People think that just because you're on medicine, that the voices will completely stop, but you just can't stop the voices. With medication, it's more positive listening, it's more just zoning out. As long as I'm not thinking of negative, horrible things.
My soul was leaking out of my body. I just saw a human being empty.
I'm good. So you can't turn the voices off, you can just make them to what you prefer to hear.
Be conscious of something that will take your attention from that negative situation into a positive one. And you know, it takes a lot of discipline, but little by little, it becomes a habit.
1 in 5 New Yorkers has a mental health issue, but people don't talk about it because of all the stigma.
There's still a lot of stigma, but people are starting to understand it a little bit better.
Kind of like a big reason why I started my clothing line was that I was on the subway and I looked down the subway train and there was a homeless schizophrenic guy just talking to himself, and I noticed it was in the same exact mannerisms as I do it. So I kind of thought to myself, what's the difference between me and this guy? And I realized if I didn't have my friends, my family, my doctor, I could so easily be in his position. Part of the reason I started my whole business was to just tell everybody that I have schizophrenia. Showing people you can live a completely normal life, medicated, and be a completely normal person. And my whole thing is, if everyone would just kind of tell people that they have a mental illness, there wouldn't be so much stigma. There really shouldn't be any stigma. That needs to go away. Mental illness is so common. How can there be so much stigma? So I kind of wanted to do something that could raise awareness, give back to the mentally ill homeless community, and just kind of make a difference.
Hi, how are you guys doing? Schizophrenic NYC was all made by me, schizophrenic New Yorker, trying to change the way New York City sees mental health, especially the mentally ill homeless. Donate a portion of the profits to help them out. Yeah.
I just pack up my bag, I wheel it over to my shop every Saturday, and I just sell my merch, and I talk to amazing people. Yesterday, I met 2 people that work in a psych ward. We had the greatest conversation about psych wards. They totally bought something for me, and they took my card, and they're like, we love what you're doing, this is so great. You know, mental health professionals love what I'm doing, they always think it's great. I've gotten negative reactions, like one lady came up to my booth last year and says, I can't believe you would name a business this. This is offensive, and I'm a mental health advocate, and this is offensive, and she took my flyer and ran away, and I was like, can I tell you about it? I'm a mental health advocate too, and she just ran away, and I was like, isn't that stigma? Aren't you judging me before I even tell you about it? Stigma right there.
This shirt's pretty awesome. It's not a delusion. You are incredible.
Some common questions that I get is, what medications are you on? Mostly by people in the mental health field, they want to know. Other common questions are like, how to handle somebody in a crisis. I mean, definitely never tell them that they're wrong. Don't try to take away their feelings. You always have to be sympathetic. I would try to convince them that they should seek professional help. Find a good doctor, find the meds that work. If you try hard enough and you really want to fix it, you can. Don't take your medication, feel better, and then think you don't need your medication anymore. I took a lot of pride that I had to say, I need medication, and I'm just gonna take it.
My advice to someone who's going through it is be honest. If you keep telling people you're fine, they'll believe it.
I believe there is a component beyond medical treatment that it has to be with education and creating positive voices that can influence and override the negative ones.
Just because they have schizophrenia doesn't mean that they can't be someone who will contribute to society, who can make the world a better place.
You hear voices and you think they're real, but they're just not. I didn't always have schizophrenia.
He is mentally ill and a New York City prisoner.
I remember a time when I was fine and I didn't hear voices. I had a lot of friends growing up. As my mental illness started attacking me, I started losing those friends.
And more than 2 years ago, Saul Nunez lost his freedom.
When I first got here, I felt so terrible that I just ate.
At 19, Nunez was accused of using a cane to hit a 91-year-old man over the head.
I believed I was fighting a spiritual war, catching souls of demon spirits.
He was diagnosed with schizophrenia at Bellevue and then sent to Rikers.
Mr. Lawrence.
The victim, Juan Lawrence, forgave Nunez when he met the young suspect's mom a month later. Nunez hasn't been able to post $75,000 bail on a felony charge that could carry between 7 and 15 years in prison.
Saul should be in a mental hospital.
But there aren't enough beds to accommodate the large number of mentally ill who are either homeless or in the jail system. There's always been concern about the severely mentally ill who stop taking their meds. That was the case with ex-con Alexander Bonds, who fatally shot Detective Miyasota's Familia in 2017.
Do you think you need to be in a mental hospital?
No.
Why?
Because I've excelled at my therapy. I am medication compliant.
A couple of years before he was diagnosed, Nunez once got in trouble for posting a thread on Facebook about his high school English teacher.
I was saying that if they didn't fire him, God was going to send a Harrier missile and blow up the school.
Now Nunez gets monthly injections of the schizophrenia drug Invega.
I hear voices, but they've reduced. They're not negative anymore.
Yet the medicine comes with side effects.
I grew like breast because my prolactin levels went up.
Dr. Elizabeth Ford of HHC talked about that in 2018.
Psychiatric medications all have side effects.
I know that my medication is something that I need.
And he explains why he wanted to do this interview.
I just wanted a voice. I feel like I was thrown in jail.
After a long journey through criminal court, Nunez's case has moved to mental health court, and there's hope he can be released. Nunez's mom visits her son once or twice a week.
She's here for me through my hardest moments. I see myself as a young man who has a long life to live, and now that my mind is clear, I feel like I can get a lot of things accomplished.
I'm Mary Murphy, Pix 11 News.
Hi, welcome to Do This, Not That. I'm Sue Self, licensed clinical social worker and behavioral health liaison manager for BJC Healthcare. Today we're trying to understand and feel competent and confident when providing care for patients who experience hallucinations.
They say they're gonna hurt my family.
Okay, the voices that you're hearing, I can't hear these voices. What I need you to do is tell me what they're saying so I can help you.
It makes sense to me, and it's perfectly okay to be uncomfortable when someone is behaving oddly or out of the norm. The key is to push through that discomfort to provide good care. I know the first patient I had who was hallucinating scared me to death. The truth is, it's more grandma than grad school. You don't need to be a master's level licensed professional who works on the psych unit to help a person through a difficult time. You just need to know what to do. So let's talk about hallucinations. First, hallucinations are present in many medical disorders, and every patient with hallucinations does not have a psychiatric illness. They can occur in any sensory domain, most commonly auditory and visual. A patient experiencing hallucinations is reacting to sensory experiences without the presence of stimulus. The visual and auditory hallucinations can be interactive or more like a movie. You could see psychomotor agitation, like pacing or rocking. An inappropriate affect, laughing, smiling, or crying in the absence of an appropriate cause. The patient looking over her shoulder or somewhere else in the room, or a lot of eye movement. They may seem distracted, unfocused, unable to carry on a conversation, ask you to repeat yourself, or appear confused. Their lips could be moving, or they could be speaking to someone other than you. They may be talking to you but think you're someone else, or saying things that don't make sense.
Potato, tornado.
You could see latent speech, a delay in answering questions, as if the patient is seeking advice from someone who isn't there.
And how old are you?
I'm 103.
Psychotic hallucinations address, accuse, seduce, humiliate, and jeer. The patient interacts with them. It's these types of hallucinations that pose the greatest risk, because the voices and apparitions often instruct the patient to hurt themselves or others. And sometimes a patient will engage in risky behaviors in an effort to make the voices stop. So what's going on here? What causes this? Hallucinations can be caused by a lot of things. More common ones are a medical condition, glucose, nutritional, or electrolyte abnormalities, carbon monoxide poisoning or lead poisoning, post-anesthesia, brain masses, injuries, or disorders, adrenal and thyroid conditions, fever, infection, or serious illnesses, a sensory problem such as blindness or deafness, being drunk or high or coming down from drugs or alcohol, PTSD, a physiological brain abnormality affecting perception and thinking. So what action should a healthcare worker take? First, begin ruling out possible medical causes, even if there's a known psychiatric disorder. Next, we need to remind ourselves that hallucinations don't necessarily mean that there's a safety risk. Not all of these patients need to be on the psych floor. If a patient appears to be hallucinating, ask directly about what you observe. For example, are you seeing things? Are you hearing voices? Are they speaking to you or about you? What are the voices telling you? Do you think that you're in danger? Has this happened to you before? Ask if the patient is considering behaviors that would result in negative outcomes. Then use their answers to assess risks like harm to themselves or others or elopement. If the risk is not manageable, follow your organization's protocol and document the specific hallucinations. Don't argue about what is real and not real. Don't challenge the patient or try to dispel the hallucination with logic. Don't touch the patient, at least not without asking permission and explaining what you're doing. Take a respectful instead of condescending tone. Regulate your voice to a lower volume, tone, and slower rate. Ask permission to do things to the patient. Ground them in reality by talking about items in the room. Convey that you believe the patient is hearing or seeing things, because they are.
Hi, Melissa. I'm Jennifer, your nurse. How are you doing today?
What?
Are you okay?
I'm sorry. I couldn't hear you. Those people are talking.
You can hear someone talking? Where?
I don't know. Close. They're saying I shouldn't be here.
Here, Melissa, look at me. Someone's talking to you? I can't hear them talking. They're talking about you? What else are they saying?
That I'm stupid. That I shouldn't have let the police bring me here. I shouldn't be here.
Do you know where you are?
Not exactly. They don't want me here. I shouldn't be here.
Can you see these people? Melissa, can you see people?
No.
Are they talking to you at all?
I don't think they know I'm listening. They hate me.
That's terrible. Are you seeing anything that I might not be able to see?
No.
Melissa, do the voices ever tell you to do things? Melissa, pay attention. Okay, let's just see if we can have you straighten up this tray table. Get ready for your breakfast while you're talking to me, okay? Do the voices ever tell you to hurt yourself or anyone?
Not these people.
But some do?
Those people went away. I don't talk to them anymore.
That must have been awful for you. Before you said you weren't sure where you are. You're in the hospital, and I'm your nurse. Do you think it's safe here?
No, it's not safe anywhere.
It must be frightening for you. What are you most worried about?
That they're gonna come and get me? I don't want to go with them.
Well, we'll do everything we can to keep you safe here. Melissa, I need to take your blood pressure. Can I do that?
They say I shouldn't let you do that. Stupid.
I know those people you hear don't want me to take care of you, but I'm worried about you. And I just want to help you get well. Will you let me help you?
I want to go home. It's better there.
Well, until you're ready to go home, are there things that we can do to make you feel safe? Maybe things that we can do to help with the voices.
Maybe.
What do you do at home to help with those voices?
I watch TV, but my TV only works on channel 113. At night, the light has to be on. Sometimes I listen to the radio. It helps drown out the voices.
Well, let's do that. I'll turn on the TV and you see which channels work here. I'll make a note for the night nurse to make sure you have your light on at night. Maybe she can check with you about which lights can quiet the voices. When you find the right channel, maybe then I can take your blood pressure. I'm gonna go find a radio for you, okay?
Thank you.
You're welcome.
Some important points to remember are that the patient is often frightened by these experiences. They're afraid they'll be seen as crazy or insane. Often friends and family ignore the hallucinations. Not every patient who hallucinates is dangerous, nor do all of them need to be in a psychiatric unit. See him or her as a real person, not as a disorder. Patients need reassurance, compassion, and grounding. Remember what we said earlier, you don't need to be a psychiatric professional to help a person through a difficult time. You just need to know what to do. Thanks for watching.
Hallucinations, staring episodes, and sometimes violent. That's how caseworkers described a Western Iowa teen on trial for murder. Good evening, I'm Craig DeGrelli.
And I'm Emily Zink. The defense continued to show 18-year-old Cody Metzger-Madsen as very troubled. He's accused of killing 5-year-old foster brother last year in Logan. Reporter Kim Foley has more on today's testimony.
Today, teachers and caseworkers testified about their experiences with Cody Metzger-Madsen. They described a teen who lived somewhere between fantasy and reality, someone who would go into violent fits and then have no recollection that it even happened.
By that point, we had taken his shoes because he had thrown his shoes at us. When we would try to debrief him afterwards about it, it was like it didn't happen.
Cody Metzger-Madsen's former principal testified that the teen often appeared to be in an alternate world.
He would see monsters or aliens outside the car, and he would be trying to shoot them with his gun.
Today, the defense called 6 witnesses ranging from school aides to social workers to Metzger-Madsen's DHS case manager.
My understanding is that his mother reported using crank in the first 2 months of pregnancy.
Between his mother's drug use and an abusive family, defense attorney Michael Williams described Metzger-Madsen as someone who never had a chance.
It definitely looked like it hurt because I remember Cody cowering back and covering up, trying to get away from him.
Once Metzger-Madsen became a ward of the state, he bounced around from school to school, many of them specializing in kids who have behavioral and emotional issues. Staring episodes, violent blackouts, and hallucinations, all part of the defense's argument that Metzger-Madsen cannot tell what's real and what's not.
He was very adamant that there were snakes all over our lunchroom, and he was tiptoeing through them and making kids get out of the way.
Instances that the defense says Metzger-Madsen was in an unstable mental state when he allegedly killed his 5-year-old foster brother, Dominic Elkins. Court will resume on Wednesday when the defense will continue calling their witnesses. In Logan, Iowa, Kim Foley, KMTV Action 3 News.
The nationwide flu outbreak is showing no sign of easing up. So far this season, more than 14,000 people across the country went to the hospital for flu-related symptoms, and at least 53 children have died, including 3 from Ohio. We're now at week 10. Flu seasons typically range from 11 to 20 weeks. This year's epidemic could last until May. And there are now growing concerns about a medicine widely used to treat the flu.
Right. Parents all across the country are reporting their children started hallucinating after taking Tamiflu. One family is even blaming their son's suicide on the medication. But is this cause for panic?
Tamiflu, like any medication, has potential side effects.
Among them, neuropsychiatric side effects.
It's not always actually clear whether it's the medication itself or the virus, because influenza can cause something called encephalitis, which is inflammation of the brain, which can lead to some of the same symptoms hallucinations, confusion, altered mental status, that sort of thing.
A family in Indiana says their daughter was hearing voices and saw bugs on her body after starting Tamiflu. In Texas, a couple says their 6-year-old daughter tried to jump out her bedroom window while on Tamiflu.
She was about to jump out the window when my wife came up and grabbed her.
And less than 24 hours after starting Tamiflu,
had I known that this was an issue, I would have never given it to him.
This Indiana teen committed suicide. His parents are adamant the medication is to blame.
We are seeing the side effect more this year than we've seen it in previous years, but that's just because the total number of kids taking the medication has gone up, not because there's something wrong with the medicine itself.
Dr. Amy Edwards with University Hospitals, Rainbow Babies and Children's Hospital says such dramatic side effects are extremely rare.
For the parents who are insisting that their kid get Tamiflu because of how scared they are about the pediatric deaths we've had, if your kid is not high risk, then you do need to think about the fact that this drug does come with side effects.
But if your child is high risk, meaning under the age of 2, or has health issues like diabetes or asthma, Tamiflu might be their best option. And if you notice anything alarming, see your doctor right away. Again, psychiatric side effects are a known side effect of Tamiflu, but they're extremely rare. Dr. Edwards says it happens in less than 1% of pediatric patients. Evidence also shows that Tamiflu is only really helpful if you've been sick for less than 48 hours.
Unknown illness causes hallucinations in Oregon. An unknown illness appears to have spread from one woman to 4 other people in Oregon, including 2 deputies, causing them all to have hallucinations. The incident began at around 3 a.m. on Wednesday, when a 57-year-old caregiver reported someone vandalizing her car outside the home where she works in North Bend. A deputy responded to her report but found nothing. The caregiver called the police again several hours later. The deputies then suspected the woman might be having hallucinations caused by medical issues. She was taken to the hospital for examination, but medical personnel were unable to find anything unusual, so she was released. Shortly after she was released, the 2 deputies who handled the caregiver began having hallucinations and had to be hospitalized. The 78-year-old woman who was being cared for by the woman and a hospital employee also began exhibiting signs of hallucinations and had to be hospitalized. The Coos Bay Hazmat team has not yet found the source of the contamination, but they said the illness appears to be passing through human contact. See a story that really should be animated? Suggest stories to Tomo News Now.
Body camera videos are increasingly being used in court in civil suits against law enforcement and first responders, including the case Jim Axelrod is about to show you in tonight's Eye on America. And a warning, some of what you are about to see is graphic.
It's been a year of crippling emotion for Cindy and Paul Tarashuk. A year since the death of their 26-year-old son, also named Paul.
Still not easy to talk about, is it?
No, it's talking about him gets me really upset. Talking about this stuff gets me angry.
Paul Tarashuk had schizoaffective disorder, suffering delusions and hallucinations. But he was getting on with his life until one night last September when he had a psychotic breakdown traveling along this highway near Orangeburg, South Carolina.
I stopped a few exits back.
Parked for a roadside break, a trucker suddenly saw Tarashuk walking toward him.
He comes running up in my headlights at me. Naked man. Freaks me out. I take off.
As the trucker drove down the interstate, he realized Tarashuk was riding on his rig and called 911.
Can you come on down? Come on down. What's going on? What's going on?
Officers from 3 different law enforcement agencies responded, including Orangeburg County Sheriff's Deputy Clifford Dorowski.
Oh, he's under the influence. Nobody can see that?
Who was certain Tarashuk was high or drunk.
They just want to check your vitals.
Dorowski's body camera recorded what happened when EMS arrived.
You speak English? Hey.
Tarashuk didn't answer the first responders, who were berating and cursing at him.
I'm being serious. I'm sleepy. Give me a damn name so I can go home, for real. I'm tired.
So they shoved an ammonia capsule up his nose.
Breathe that in.
He didn't flinch.
So there, I mean, at that point, someone should have stepped up and says, we got to take him in someplace. He's not just someone to let go.
Do you want to go to the hospital? Yes or no? Do you want to go to jail? Well, those are your two choices.
Then come on, I'm gonna give you a ride.
As troubling as it is to watch how the ambulance crew treats Paul Tereshuk during the call, it's even more disturbing to watch the sheriff's deputy after.
You're not going to jail. You're not under arrest. I'm gonna give you a ride. I'll give you a ride to a safe environment. That's all I want. I want to make sure you're all right.
The deputy puts Tereshuk into his cruiser, drives him 15 miles to this gas station near the county line, a gas station that was closed at the time. This is the last time Paul Tereshuk is seen alive. No shoes, no phone, no idea where he is.
It's just watching him walk to his death. He was escorted by an officer to his death.
I think I just hit a person on the interstate.
Nearly 5 hours later, the same EMS crew was called to deal with Tereshuk again, back on the same highway. This time, he was dead. A toxicology report from the Orangeburg County Coroner's Office came up clean. No drugs, no alcohol. Despite this, Deputy Clifford Dorowski is still on the job at the Orangeburg County Sheriff's Department, and so is one of the EMTs, State Senator Katrina Shealy.
Has there been, in your view, enough accountability?
I think there needs to be a better investigation into what happened. I mean, we can see it on the video. I think somebody, needs to explain to them why it happened, which they haven't. I mean, you can't explain it away.
We asked EMS and the Sheriff's Department for on-camera interviews. They both declined, citing an ongoing investigation.
They didn't do their job. That's it. They just didn't do their job. They didn't care enough about human life to do their job. Jim Axelrod joins us tonight. So, Jim, what recourse do the parents have?
Well, they filed both state and federal lawsuits today. I spoke to the family's lawyer just a short while ago. He says, sure, they're looking for justice. They're looking for accountability. They're looking for answers. They're also looking for a significant monetary award to get the attention of lawmakers in South Carolina to change things and ensure no other family will have to go through something like this.
Yeah, so it never happens again. Jim Axelrod, incredible reporting. Thank you so much.
Let's demystify what those terms mean. What are psychosis? What is schizophrenia?
Yes. Psychosis can describe a state of having a change in behavior, change in perception, maybe starting to, I think classically you hear about things like hallucinations, starting to hear things or see things that aren't there, that other people don't experience, maybe developing false beliefs, thinking that other people are talking about you, thinking that maybe somebody's following you or going to hurt you. But there are other symptoms of psychosis that are not always recognized as psychosis. Thought disorder, having some kind of alteration in the flow of thought. Maybe things get jumbled up and confusing. It's hard to communicate. And then there can also be what are called negative or deficit symptoms, a loss of interest or pleasure, maybe not showing very much emotion, not showing motivation. So it's really all of those things together. And psychosis can characterize a lot of different situations. So for example, somebody could be high on drugs and show psychotic symptoms.
Chemically induced.
Right, chemically induced. There can be rare medical problems that can cause psychosis, like a brain tumor, for example, could cause a psychotic symptom. But the most common forms are schizophrenia, and then sometimes mood disorders, such as bipolar, manic depression, or depression can have psychotic symptoms along with them.
Listening to you talk, I was channeling back to our discussion just before the show started, and that is so many of the things that you mentioned go along with being a teenager, for example. And I think every parent at some point worries that their kid might be depressed or have lack of motivation or is not interested in engaging and have at least superficially seem like they have some of these.
Visualize yourself out with friends. You're at your favorite restaurant waiting to be served. Suddenly, you notice people are watching you. You begin to hear people whisper your name. You know they're about to do something. Your friends don't notice that you're all about to be harmed. You mention what's happening to your friends, and they're confused. You have to make them understand quickly before something bad happens. If you've experienced something like this, it could be psychosis. Did you know that a little over 3% of all people will experience psychosis at some point in their lives? That's over 11 million people in the United States alone. In any given year, about 100,000 teens and young adults will experience psychosis. Most people have their first experience with psychosis between the ages of 15 and 30. People experiencing psychosis can have all or a few symptoms. Psychosis occurs across all cultures and to people of all levels of education or income. So, what is psychosis? Psychosis is a word that describes what happens when people are experiencing and perceiving the world around them differently than others. These differences can include seeing things that are not there, such as people, animals, colors, or shapes, even shadows, hearing voices or sounds that other people do not hear, disorganized thinking that can make it difficult for other people to understand what they're trying to say, sharing thoughts or beliefs that others who are close to them might find strange or unusual, such as believing that they have special powers, or that they're being watched, followed, or spied on, or that they are receiving messages through the television or internet that they feel are meant just for them. People who hear and see things that others do not may appear to be distracted or take a few moments to respond when asked a question. Sometimes, people experiencing psychosis may have a hard time concentrating, or their thoughts can get mixed up. Every person's experience with psychosis is unique. Unfortunately, psychosis is a word that can be misunderstood. A common misconception is that people with psychosis are dangerous or crazy. People experiencing psychosis are more likely to be withdrawn, confused, or frightened than violent. Another myth is that psychosis will not get better. Symptoms of psychosis can be managed through support, therapy, and by taking medications. People who have experienced psychosis can go on to lead healthy, productive lives. Recovery from psychosis is achievable through early intervention. Studies have found that the earlier someone gets help with psychosis, the better their outcomes will be. If you or someone you know may be experiencing psychosis, contact a mental health professional to start on the path to recovery as soon as possible.
I think it can be a bit of a misconception that someone with psychosis hears voices, but I never have heard voices. I just see things that aren't there. So I think that's useful to know if you're someone who's experiencing it, but you don't have voices, you don't hear voices, that you could still be experiencing psychosis.
Yeah. So like when you hear voices, it's a really, really weird experience, you know. You know that other people can't hear it because they're not reacting to it, but you wonder why other people can't hear it. And you're like wondering where the source is, and you'll look around like where is this coming from, and it's impossible to really concentrate on anything else. And it's loud, and it's annoying, and it's intense, and it's hard. And it's not until you start to speak about them and learn coping strategies for them that you learn to manage them in a healthy way.
Because there's one thing you've got to remind yourself with psychosis, as catastrophic it can be, as bad as it can be, you go ill, and I would say within, a week and a half of being sectioned under that intense care, you do feel better. And that's what makes the management and treatment of psychosis quite interesting, actually, because your real game plan is reducing the regularity of psychotic episodes.
The spiridone didn't do much for me, really. It just made me feel worse, and it didn't do much for the voices or anything, but the severity at first worked a bit, but it only didn't last very long. The effects just lasted like half an hour, that I didn't have all the voices all the time. Then it just wore off. But I was taking a lot of it, and it just wasn't powerful enough, to be honest. And the rest of them, well, quetiapine, I can't remember if I don't think it helped, but I can't remember totally. And Abilify didn't do much. It's the only thing that's helped really is time, I think.
Almost now I feel that if I get hallucinations and voices and they say, and they're trying to warn me stuff, and I just go, nah, I'm ignoring you, go away, that's probably not going to be that productive either, because they'll get angrier and then I'll get worse stuff. Yeah.
But no, with members of staff in general, there's been good ones, amazing ones, and ones that are truly like, you're like, why do you work in the caring profession? I've never met a person that cares less about other people. So some people have really bothered to sit down and try and work it out with me. And some people, they just don't give a damn.
When you've lost contact with reality, you don't need forced artificial interactions. That just makes it worse. You need some humanity. That's why early intervention psychosis services work so well, because they're just humans. They're not pretending to be some sort of super mental health nurse. They're just, yeah, let's go and grab a coffee and talk about stuff.
How to recognize the symptoms of bipolar disorder. Also known as manic depression, bipolar disorder is a mental illness that can be controlled with medication. Learn to spot this condition's hallmark behaviors. You will need close observation and intervention. Step 1. Look for mood swings, either abnormally elated or excessively angry or sad and hopeless. Onset may be gradual or dramatic, and behavior can be unpredictable. The key is that these mood shifts interfere with a person's life and ability to function. Bipolar disorder can show up as early as childhood, although it more commonly develops in late adolescence or adulthood. Step 2. Recognize a manic stage. Symptoms include a change in mood that may include euphoria, increased energy, a decreased need for sleep, restlessness, impulsiveness, and risky behavior like spending sprees and drug and alcohol abuse. Step 3. Recognize a depressive phase, which can manifest as sadness, hopelessness, insomnia or an excessive need for sleep, changes in appetite, and thoughts of death or suicide. Step 4. Know the 3 main types of the disorder. Bipolar 1 involves manic episodes with or without a depressive phase. Bipolar 2, which involves depression and at least 1 hypomanic episode, which is similar to mania but is less severe. And bipolar NOS, standing for not otherwise specified, in which a person's symptoms don't neatly fit into either category. People with less intense mood swings may have a condition called cyclothymia. Step 5. Watch for psychotic behavior. If a BD sufferer sees or hears things that aren't there, or suffers from delusions, they are showing signs of psychosis and should not be left alone. Seek treatment immediately. Step 6. See a mental health professional if you are displaying any signs of bipolar disorder, and encourage anyone you know with these symptoms to do the same. Bipolar disorder can be controlled with medication and tends to get worse if it's left untreated. Did you know? Bipolar disorder affects approximately 5.7 million American adults.
Very high and very low. The mood swings caused by bipolar disorder can range from one extreme to the other.
Moods are kind of a natural experience that we all have, and bipolar disorder is something outside of that. It's more extreme experiences.
Psychiatrist Dr. Daryl Tansky says bipolar disorder is classified as a mood disorder.
The illness usually starts to manifest itself in the late teens to young adulthood years. Genders are equally affected.
But the cause is unknown. Health experts say bipolar disorder is a brain illness where 60 to 80% of people diagnosed have a family history of it.
It's a challenging diagnosis, first and foremost, because we don't have a laboratory study or an X-ray that we can rely on.
The condition will often present with depression. When diagnosing a patient, health experts will often look at the patient's sleep habits, excessive elevated moods, and risk-taking behaviors. All can lead to a positive diagnosis.
Once it's established itself as a chronic condition, the assumed likelihood of recurrence without treatment probably approaches 90%.
Treatment consists of prescription medication along with counseling to help the patient manage their stress, diet, sleep, and exercise.
The goal of the treatment is to take the extremes in mood and have that to a more comfortable mood.
The diagnosis and treatment can vary from patient to patient. For Lee Memorial Health System, I'm Lindsay Fry.
Superstar Mariah Carey revealing her secret struggle with bipolar disorder for the first time. Telling People magazine she's been living in denial for almost 20 years. And Amy is here with more on why she's ready to share her story now. Good morning, Amy.
Good morning to you, Michael, and everyone. And there has long been concern about Mariah Carey's mental health following a series of high-profile public incidents. She says these have been the hardest couple of years I've been through, and now she is opening up about it after finally agreeing she needed help. She's pop music royalty with a one-of-a-kind vocal range. Mariah Carey's been ruling the charts for nearly 3 decades with 18 #1 singles to her name. But through her successful career, fans have watched her personal ups and downs, more recently documented on her reality show Mariah's World, and even this bizarre 2016 performance on New Year's Eve amid technical difficulties.
We didn't have a sound check, but it's New Year's, baby. That's okay, you guys.
Now Carey revealing she's been hiding a secret struggle for nearly 17 years, a battle with bipolar II disorder. The singer-songwriter opening up to People magazine, saying, "Until recently, I lived in denial and isolation and in constant fear someone would expose me. It was too heavy a burden to carry, and I simply couldn't do that anymore." Back in 2001, Carey received her bipolar II diagnosis after suffering a very public emotional and physical breakdown. The star ultimately hospitalized. The disorder is characterized by unusual shifts between mood, energy, activity levels, and the ability to carry out day-to-day tasks.
No, Cindy, one more thing. And we give them positivity.
Let's go. Stop.
That was the same year of her whirlwind promotional tour for her feature film Glitter, which fizzled in the box office, and even rumors of an alleged suicide attempt, which her team has denied in the past. She spoke about her nonstop lifestyle on The View.
I never took a break. I never learned how to just put myself before my career. I just didn't. I just started making records basically right out of high school and never stopped.
Now Carey says she's receiving various forms of treatment to help cope with her disorder, including medication, saying I'm exercising, getting acupuncture, eating healthy, spending quality time with my kids, and doing what I love, which is writing songs and making music. Despite her sometimes tough journey, the music powerhouse is finding her inner strength with a positive outlook. I believe that everything happens for a reason, so maybe it just took me going through one of the hardest couple of years that I've been through in order to come out in a positive place on the other side. Now, one of the reasons why Mariah says she is sharing her story, she is hopeful that, and she says, quote, "We can get to a place where the stigma is lifted from people going through anything alone. It can be incredibly isolating. It does not have to define you, and I refuse to allow it to define me or control me." So she is opening up, and I think probably feels very free now that she's shared this.
I'm sure she's taking over. And we're going to bring in the writer of the piece, People's editor-in-chief, Jess Cagle. And Jess, this takes a lot of people by surprise that she's saying this. So when was she first diagnosed?
Well, she was first diagnosed, as Amy said, back in 2001. And she just did not want to believe it. You know, at that time, it was a very well-publicized physical and emotional breakdown that she had. And she just didn't want to believe it. And in her mind, although it's wrong, of course, she thought that there was such a stigma attached to having bipolar disorder that she would, you know, that her career would be in.
So she didn't get medicated then?
She did not get medicated then.
Wow, so 20 years.
Almost.
Why is she now coming out today, now?
So she, as you say, she went through the hardest couple of years that she's been through. And I think, you know, we saw some of that. There was a brief engagement. There was an reality show. There was some professional upheaval. And I think finally she got to a place where she decided, I need to get help. And so she's recently been treated. She's in therapy. She's on medication that's working very well. And she got to a place where she was able to talk about it. She made peace with it. And also, she just didn't want to have this secret hanging over her, because part of the struggle over the past few years that she was so afraid that somebody in her orbit was going to tell this story for her. And so she took the opportunity to tell the story herself. She was very inspired by other people who've talked about mental problems that they've had, and she really does want to help people and kind of set herself free.
Yeah, that's exactly what Amy was saying, and it is when you're holding the secret and then you reveal it, it's very freeing. But you keep saying about how she was fearful that it would hurt her career, but I'm already hearing from people, because I posted on Twitter we were going to be talking about this, and somebody even said, I've always loved her music, I didn't like her, but now I understand and respect her.
Right, I think it's going to help fans understand her. It's going to give people a lot more respect for her, because this is a brave, generous thing for her to do, and it will also help her get back into the studio and make music, which is what she really wants to do.
Robin, what do you say? What'd your mama say?
Make your message. And that's what she's doing. That's what she's doing, and it is. It's going to really help a lot of people. Always good to see you, Jess.
Nice to see you guys. Thanks.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.
Living with bipolar illness, I think it makes me a better psychiatrist. When someone comes to me with something, I don't only know it intellectually, I know it through a lived experience. There are times where I can feel that the patient would benefit from maybe knowing that I really understand what they're going through. But I think right now, unfortunately, within medicine and even within psychiatry, stigma still does exist. I'm hoping that maybe one day I will be able to be more open about it. Because it does feel like I can't really share a big part of myself that could potentially benefit someone else, right? Or give them hope. I had this great life, I was in medical school, I had great friends, I had a great family, and I had a certain vision of what my future was going to be. When I first experienced my first episode, the psychiatrist felt that I needed an antipsychotic medication. And that moment was like, it's almost like the carpet was pulled from under my feet. Kind of saw myself as, like less than and mentally ill. I really felt the stigma. I had a hard time looking people in the eyes and facing friends. People were talking about, oh, when you get better. And I would look at them like, when I get better, what are you talking about? This is how I'm gonna be for the rest of my life. I was thinking, I'm never gonna return to school. This is never gonna get better. And you're also sort of grieving that amazing life that you thought that you were gonna have, and all of a sudden it's gone. The first depression that I experienced was very, very severe. I had to take a year off school. I spent most of my time in bed, and my family had to literally come and peel me out of bed off the floor. All I could think about was just dying. Every moment was just agony. Every moment felt like an eternity. Just feeling like I'm hopeless. I'm never gonna get better. My life is over. When I kind of lost faith in myself, I had several friends just regularly calling me, and they would just remind me, we love you, we're here for you, this is who you are. But I was thinking about all these ways that I would end my life. I never attempted. The only thing that kept me alive was I could not hurt my family and my friends. I just couldn't. When I started the recovery process, never in a million years did I think that I was gonna come back to school. I never thought that I was gonna get married. I didn't think that I would have a family. It was a good year and a half until finally we found the right combination of medications, and until I really fully recovered and started to feel fully like myself. the #1 most important thing in my recovery is the people around me. I have a really amazing and supportive husband, really, incredible parents-in-law, a very strong friend network. Everyone knows about, my illness, and they're very open with me. Thankfully, I haven't experienced a depression in years, but I definitely do fear it. It's not like at the forefront of my mind, but because of that, I do everything I can to prevent it. I try to keep it in perspective. Okay, it's part of who I am, but it doesn't define me. It affects me, but it doesn't define me.
Eyes wide open, unafraid to be alive. You're living and you're breathing. You will make your way through the valleys of your soul, coming home to the truth about the world.
It is so debilitating. It is so crushing. It crushes the will to live.
A bunch of ups and downs destroyed a lot of my friendships and relationships.
I was working in a cool job, and everything I could think the entire day was, how do I kill myself?
People were talking about, oh, when you get better. I'm like, when I get better, what are you talking about? This is how I'm gonna be for the rest of my life.
How did I get here? How did it get to a point where I can't control myself?
In this week's People magazine, a Grammy-winning singer shares her struggle with bipolar disorder. Mariah Carey says she was first diagnosed in 2001, but only recently sought treatment. The pop star calls the disorder isolating and hopes talking about it helps lift the stigma on others. So what exactly is bipolar disorder? Good question. Here's Heather Brown.
So your son has bipolar disorder?
Yes, ma'am.
And I didn't know what was wrong with me.
The gentleman that I particularly remember was very nervous, not making a lot of sense.
More than 4% of American adults have experienced bipolar disorder, including Demi Lovato, Jane Pauley, and Jean-Claude Van Damme.
Bipolar disorder is a serious, major mood condition that consists of a couple different types of mood states.
Dr. Kaz Nelson teaches psychiatry at the U of M Medical School.
The first, people might have a condition called mania.
I started to feel so good, my husband was concerned.
Feeling better than they ever have, more energy than they ever have.
Talking very random.
Making plans. Sometimes even have delusions.
That alternates with periods of severe depression.
They lack interest in things they normally like to do. They have very low energy.
He had some behavior issues and went to the hospital.
They may feel sad, hopeless, even have thoughts of suicide.
So this is more than just mood swings.
That's right. Bipolar disorder, these mood states are on the order of days or weeks even.
It's hard really to say when it began.
This is something doctors actually diagnose.
Yes, absolutely.
How do they diagnose it?
Well, It can be hard to diagnose if we're just seeing somebody at one point in time.
There are no blood tests, no brain imaging.
It's really looking at the person's story over time.
It's just like diabetes. You have to find the right treatment.
That can include mood-stabilizing drugs, consistent schedules.
I watched my sleep very carefully.
And therapy.
People can actually be highly functional with bipolar disorder if it's appropriately treated.
How's he doing now?
Now he's doing fantastic.
Heather Brown.
He's taking his medication and he's just doing well.
WCCO 4 News.
Researchers do know there can be a genetic and stress link to bipolar disorder, but they don't know exactly why the brain of someone with the illness functions differently than someone without it.